Assalamu alaikum. Starting with the clinical cases, we have Mr. Ali, 35 years, with complaint of gradual loss of vision. We'll start in seconds. Be ready, please. Okay, ready?
Yeah,
Yeah, here you
okay. Hello, I'm Dr. Rouhani, the doctor in the clinic. Am I speaking to Mr. Ali, 35 years old?
Yes, Doctor, I am.
Mr. Ali, we are here today to discuss some issues with you. I will take some information and examine you as well. Is that okay with you?
Okay, Doctor, please.
Please, if you want to ask any question, do not hesitate to stop me and ask, okay?
Okay.
I also may take some notes. It will be very confidential, but all my attention will be with you. Okay?
Okay.
Would you please tell me what brings you to our clinic today?
Actually, Doctor, I am suffering from this loss of vision since 3 months now, Doctor.
Sorry for that, Mr. Ali. Would you please tell me how it started? I mean, it was all of a sudden or gradually?
Gradual, Doctor.
Is it progressive? I mean, it is the same like the start or increasing?
It is increasing, Doctor.
And since 3 months, it increased, right?
Yes, Doctor.
Okay. This is in a special time of the day, I mean in the morning, in the evening, or so all the day?
All the day, Doctor. It is not in specific to a certain time of the day.
Okay. Did you notice that you are pumping in object?
Yes, I noticed that, yes.
Yeah. Is there any associations with this gradual loss of vision? I mean, like headache?
Yes, Doctor, I have headache.
Yeah. And when it started exactly?
When it is also since 3 months also.
Okay. In which side exactly of your head?
This headache?
Yeah.
This headache in center of my head, Doctor, actually.
Okay. Did you notice that there anything increased like coughing, sneezing?
Yes, Doctor. I think it is increasing by coughing or sneezing, or even leaning forward.
I'm sorry for that. Did you notice is there anything that may decrease it like medication or rest?
A little, Doctor.
Okay. Mr. Ahmed, do you have any dizziness?
We have used what, Doctor?
Any dizziness?
No, no dizziness.
Okay. Any weakness of any part of your body?
I have, I feel fatigue, Doctor, but I didn't notice weakness.
Okay. Do you feel any weakness while combing your hair or dress your
Yes,
clothes?
yes, yes, Doctor, I
Yeah.
have this.
Sorry for that. Do you have any special sensation like numbness or tingling or burning sensation within your hands or your feet?
Yes, sometimes I feel that, Doctor, yes.
Okay. Did you lose control of your back passage?
No.
Oh, okay. Mr. Ali, would you please tell me, do you have any chest pain?
Chest pain?
Yes.
Not really, Doctor, no.
Okay. Did you lose weight or your weight changed recently or maybe gain weight?
Yes, Doctor, I have been gain weight. The picture of the patient in the group, yeah. Yes, Doctor, I gain
Yeah,
weight.
I saw. Okay. And how many kilos did you gain?
Actually, about 6 to 7 kilo over the last 3 months.
And was it intended?
What?
Was it intended?
No, no, not intended.
Okay. Do you have any sweating?
Yes, I have sweating, doctor.
Where
I noticed
exactly the
that
sweating?
in my hand and in my face.
Yeah.
I
Okay.
I noticed that my sweating is increased.
Yeah. Any bumps or lumps?
No.
Okay. Did anyone comment on your shape, or you have an old photo of you? Did you notice that you have any change of your face or your shape of the body?
Yes, doctor. I think that my face feature of my face become coarse
Yeah.
and
Did you notice any
enlarged.
change?
I don't know why this is by age or why not this.
Okay. Did you notice any change of the size of your ring?
Yes,
Any change in the size of your foot shoes?
yes,
Sorry.
yes, doctor.
Yeah. Yeah. Okay. Would you please tell me, do you have any medical past history of like high blood pressure?
Actually, since 1 month only, doctor, I have been diagnosed by both high blood pressure and high blood sugar.
And since when you have been diagnosed?
Only 1 month ago.
Okay. And are you taking the medication?
Yes, I am in metformin now for diabetes and in lisinopril for the high blood pressure.
And you are compliant to them?
Yes, doctor. But it is not controlled also.
Oh, okay. Any recent change of the dose of the medication?
Recent change of what?
Of the dose of the medication?
Actually, I started only 1 month.
Okay. Do you have any tummy pain?
Yes, doctor, I have tummy pain.
Any loose motion?
No, actually, I have hard motion.
Um, okay. And when did it start?
I'm not remember, doctor, but it may be since 2 months now. I have this hard motion.
Yeah.
But
Mr. Ali,
I try to drink a lot of water and take a lot of fiber and
yeah,
take some that step. But I
yeah,
didn't seek medical advice for this.
yeah. Mr. Ali, can I ask you some private questions if you don't mind?
Sure, doctor.
Are you married?
Yes,
Did you notice that there is any problem with the intimate relationship?
I'm not sure, doctor.
Okay.
I'm not sure. I think there is
Um,
no problem.
okay. Mr. Ali, what do you do for a living?
I am teacher, doctor.
And how much your symptoms are affecting your job and daily activities?
Actually, doctor, my vision problem bothered me, doctor, because I bump object. So I am very
Yeah.
worried about my vision, doctor.
I'm so sorry for that, and we can refer you for the occupational health team. He can help you with this regards, okay?
Yes,
Are you
please.
socially and financially supported?
Yes, doctor. Mm, I'm good.
Do you smoke?
Yes,
How many cigarettes per day?
about 4 to 7 cigarettes per day for 15 years now.
Uh, Mr. Ali, as you know, smoking is hazardous for your health, and I advise you to stop smoking, and we can help you with this regards by sending you for the smoking cessation clinic if you don't mind, okay?
Okay, doctor, thank you. I will
Do you
think about
drink
it.
alcohol?
Yes, doctor, I drink and drink. Heavy drink.
How many units?
About 17 units per week.
Mr. Ali, it's better to minimize your drinking of alcohol within the social limit. Is that okay with you?
Okay, doctor. I will think about it.
Okay, Mr. Ali, now I need to examine you, and while I am examining you, I may need to ask you some questions if you don't mind, okay?
Oh, doctor, sure. Yes.
Okay. I need to examine the hand. I will compare my hand with the patient hand. His hand is larger than mine.
Yes, it is in the photo.
Okay. I need to check for sweating. Is there sweating?
Yes, there is a sweating.
Okay. I need to check for carpal tunnel syndrome by doing the tunnel
Yes.
fine, but first I will ask him, is it painful or not?
Yes, doctor, it is painful. Don't do it, please.
Okay, then I will not tap. But if I tap, you will feel numbness, right?
Yes, 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 doctor.
I need to check the blood pressure of the patient.
150 over 90.
Okay, then I need to check the patient face for any pallor or any jaundice.
No bad or no joints.
I need to check the eye movement of the patient. Is there bitemporal hemianopia?
Visual field? Yes, there is bitemporal
Yeah.
hemianopia.
Okay, I need also to check for cataract. Is there any cataract?
No cataract.
Okay. Uh, I need to check in the neck if there is any acanthosis nigricans.
Yes, there is acanthosis nigricans and skin tape.
Yeah, okay. Mr. Ali, do you feel that when you are waking up in the morning that you are not fresh enough and
Yes,
maybe
doctor,
someone,
yes.
yeah, someone
Yes,
comment that you are snoring at night?
yes, my wife, doctor, usually
Yeah,
comment on
okay,
that.
okay. I need to check for the heart if there any murmur or added sound.
Nothing in that.
I need to check for the base of the lung if any bibasal crepitus.
No, no basal
I,
practice.
I need to check for organomegaly in the abdomen
No
and any
organ.
mass. Any mass?
No, no mess.
Okay. I need to check for the lower limb edema.
No lower limb edema, but no lower limb edema.
Okay. Also the size of the foot is enlarged, right?
Yes,
Okay. Then, Mr. Ali, I would ask you, do you drive?
yes, doctor, and I am driving to school as I am teacher, and I go to school with my children also.
Mr. Ali, I would advise you to stop driving until complete evaluation of your condition and inform the DVLA if you don't mind.
Okay.
Okay. Okay. Mr. Ali, also, I need to ask you some questions, please. Do you notice that you have increased the amount of your urine?
Yes, recently I
Okay.
noticed that.
Any mood changes did you notice?
Yes, doctor, this is problem affect my mood.
Yes, sorry for that. Um, Mr. Ali, what is your concern?
What's the problem with me, doctor? Why my vision is affected? Is
2
it
minutes,
cancer?
please.
Okay. Mr. Ali, I do really appreciate your concern. It seems that you have a condition called acromegaly. This is a medical term. The underlying cause of this, it could be a, a nasty growth present in your brain, in the main gland in our body, which is called pituitary. And this growth is compressing the nerve cable that are responsible for the vision, giving you the symptom you have, and also secreting a protein called growth hormone. This protein that causing for you all the features and the symptoms you have. At the moment, uh, I need to admit you to do complete evaluation of your condition. Also, we will refer you to a group of specialized doctor, from the gland doctor, the brain doctor, and we will do some blood tests and some scan. Is that okay with you?
You will not refer me to eye doctor?
And eye doctor, of course, yeah. We are referring you to a group of specialist doctor, yeah.
Yes. Okay.
Do you have
Okay.
any other concern?
Yes, doctor, I said you with cancer.
I do really appreciate your concern. Most probably, it is a benign growth present in the tumor, but there is a possibility to be a cancer, and there is a possibility to be this condition apart from another cancer. So we need to do full investigation first, and we will set another meeting and explain for you the result. Do you have any other concern?
No, thank you. Thank you.
Thank you.
Okay, we can
Examiner question.
move to the examiner questions.
What's your
Okay.
finding?
This gentleman has gradual loss of vision and bumping into object. He recently diagnosed with uncontrolled hypertension and uncontrolled diabetes. Also, he has symptoms of obstructive sleep apnea, and he has symptoms of carpal tunnel
تسألي ماما
syndrome.
بالله التليفون من هنا أنا شفته ميس هنا ما بعرف تسألي ماما قول لها شيء
Sorry?
أيوه
Hello?
أيوه معاكي.
Hello? And has symptoms of carpal tunnel syndrome. And of course, he has a coarse features or acromegalic features in the form of coarse-shaped features and large hand and sweating and skin tags and acanthosis nigricans.
What else? What other features of acromegaly you saw in this patient?
Yeah, I forget to tell him to open his mouth. I should ask him if he may have large tongue and prognathism.
البروجنزيزم باينة من غير ما تخليها تفتح بقها يعني باينة إن هو
أيوة
عنده
ماكروجلوسيا. أيوة.
Okay. What is the differential diagnosis of vision problem? What's the name? Bitemporal hematoma, hemianopia.
Sorry?
He has bitemporal hemianopia.
Yes.
What is the differential diagnosis of bitemporal hemianopia?
It could be pituitary tumor, it could be craniopharyngioma.
Yes. What is the differential diagnosis of headache in this patient?
Of what?
Headache.
It could be the disease itself, it could be pituitary apoplexy, it could be
Apoplexy.
sorry? Pituitary
Apoplexy.
apoplexy. Yes. It could be pituitary apoplexy if sudden headache happened. It could be due to hypertension.
Okay, this is patient has apoplexy. There's no
at the moment, no. I just say the
What is
differential.
the differential diagnosis of headache in this patient? Now, in the moment.
In the moment, it could be also the obstructive sleep apnea.
Yes.
It could be
Hypertension. He has hypertension.
I said already hypertension. I said
Pituitary hormone. Okay. Differential
I said
diagnosis of
hypertension.
constipation. Okay. Differential diagnosis of constipation of this patient.
First of all, it could be a colorectal cancer. We need to exclude colorectal cancer. It could be due to hypercalcemia if it is part of Men's syndrome.
Yes.
Yeah.
Okay. How do you investigate this patient?
Firstly, I will do investigation to confirm the diagnosis. I will check for the insulin growth like factor 1. If it is high, then diagnosis confirmed. If it is borderline or low, then I will do serial checking of glucose, of growth hormone with oral glucose tolerance test. I need to do brain imaging to confirm the pituitary adenoma. I need to do the calcium level. I need to check
Great.
for the calcium level to check if it is part of men's, if there is hypercalcemia or not. I need to do uh, investigation, basic investigation in the form of complete blood count, renal function test, kidney function test, diabetic screen, hemoglobin A1C. Also, I need to do colonoscopy for this patient at the presentation time, and according to the result, I will do follow-up colonoscopy because of the higher risk of colorectal cancer. I need to do polysomnography for obstructive sleep apnea. I need to do nerve conduction studies with EMG for the carpal tunnel syndrome.
Okay.
Uh,
You okay, thank you. What about your differential diagnosis? First differential diagnosis acromegaly, yes?
First differential, like this is acromegaly, differential diagnosis for the underlying.
أنا مش سامعة يعني. ألو؟
Yeah, there is disconnection from Dr. Muna's side. Okay, wait for a while. Maybe she had a call.
Hello?
Yeah, Dr. Muna.
Yeah.
Dr. Muna?
Yes, I hear you.
Yeah, but a little muffled your sound. Can you be more closer to the mic?
You hear me now?
Yes, clear. Yes, okay. Resume the
Yeah.
question, Dr. Shaima.
Differential diagnosis, he said acromegaly. What else?
I said it could be due to pituitary adenoma. It could be due to part of Men's syndrome. It could be due to paraneoplastic syndrome, cells that secreting growth hormone.
Paraneoplastic syndrome. Seemed growth hormone. Okay. What's your explanation for polyuria? This patient has polyuria, yes?
Yeah, first of all, could be due to diabetes mellitus. It could be due to hypercalcemia.
Yes. Yes. Okay. What is the sign of activity in the acromegaly?
Sweating, skin tag, uncontrolled hypertension, and diabetes, and
Any
headache.
symptoms? Yes. Thank you. Okay.
Sorry?
What is any symptoms? Symptoms like headache, vision problem. This is
Yeah,
a sign of activity. Okay, how do
yeah.
you treat this patient?
Treatment would be in the form of non-pharmacological and pharmacological, of course, patient counseling, education, a multidisciplinary team from neurosurgeon, endocrinologist, ophthalmologist, occupational and social worker. Um, mm, After that, and of course, gastroenterologist. Pharmacological treatment in the form of somatostatin analog, octreotide, maybe dopamine agonist like the bromocriptine, maybe bixazomone, which can be given as adjuvant. And the most important, the definitive treatment is transsphenoidal surgery, the surgical resection of the tumor.
Okay, what is the complication of surgery?
Like any surgery, it could be bleeding, infection, complications related to the anesthesia. Could be failure, they couldn't resect the tumor. Could be
after surgery this patient has come to you with severe dizziness. What's your explanation?
Have what? Have what?
Severe dizziness
Yeah,
and
it
low
could
blood
be
pressure.
adrenal insufficiency. It could be adrenal insufficiency.
What is the cause of adrenal insufficiency after surgery?
No, sorry, if you said the dizziness, it also could be cranial diabetes insipidus after brain surgery.
Okay. What is the differential diagnosis of knee pain in this patient?
Osteoarthritis,
Yes, yes. What else?
pseudo gout.
Yes. How do you differentiate between them by single test?
Pseudo gout, we can take synovial fluid aspiration, and under the microscope, pseudo gout is positive Romberg's, which is calcium.
Okay, you can diagnose pseudo gout by synovial and see the
Osteoarthritis
the
can be
positive.
diagnosed by imaging X-ray.
I said by single test to differentiate between osteoarthritis and pseudo gout.
I don't know.
X-ray. Okay. I will say يعني هنلاقي هنا هنلاقي. جزاك الله خيرا يا دكتورة منى، بصراحة جميل جدا ما شاء الله عليك. يعني كل الأسئلة جاوبتيها
شكرا
وجاوبتيها كويس
دكتورة.
ما شاء الله. ما شاء الله عليكي. بس يعني عايزين إن احنا يعني الديفرنشال دايجنوز بتاعنا المفروض أول حاجة منه. يعني
يكون
أكروميجالي
أول حاجة
ومين
إيه؟ معلش
مين
ما
وان
سامعاكي كويس.
مين
أنا
وان
قلت منون.
المفروض يعني نشرح للعيان والمريض برضه إن هي احتمال تكون يعني أكروميجالي جزء من سندروم أكبر منه، ممكن يكون involved
أيوة
many
أنا
of
قلت كده بالفعل، بس هو واضح إن صوتي فيه مشكلة. صح؟ أنت سامعاني كويس؟ لأن أنا
No,
قلت
no, no.
الحاجات دي كلها.
No, no, you said it. Yes, right. She said
I
it.
said
Yeah, she said. And she screened for it.
yeah.
yes
Okay.
yes.
Continue comment, Dr. Shema. Yes.
أنا قلت كويس جدا ما شاء الله، بس أنا مش عارفة كلمة ناستي جروس متهيألي أحسن نقول عليها أوفر برودكشن
نعم.
أو أوفر جروس. كلمة ناستي جروس متهيألي نقول عليها أوفر جروس أو أوفر برودكشن أحسن، لأن
أيوة أوفر
إحنا
جروث
مش عارفين
ممكن،
نوع.
لأنها ممكن أدينوما. صح، ما هي كانسر.
أيوه تمام
أيوة.
ماشي. أوكي.
ممكن
و
نقول إن هو جروث without nasty يعني.
أنت قلتي إنسولين لايك جروس فاكتور 1
أيوه
في ضمن الانفستيجيشن قلتيها؟
Yes,
أيوه، ده أول
yes.
حاجة
She
أنا
mentioned.
قلتها.
أوكي. أوكي والله كله كويس ما شاء الله عليكي، بس هنركز بس في الإكزامينيشن. هو لسه في الإكزامينيشن شوية يعني شوية حاجات بسيطة.
أيوه أنا
أنت
نسيت
قلتي
أعمل
الهاند.
examination للني.
أيوه الني والهاند أنت عملتيها كويس ما شاء الله كلها. بس بتيجي على الأرض تقولي I would like to check blood pressure sitting وستاندنج والإيه والبلاد شوجر. عملتي بروكسيمال مايوباثي كويس. شفتي
لا
السكين
أنا
تاج
نسيت. أنا سألت عنه بس ما عملتش examination ليه. صح،
طيب بصي احنا لو مشينا احنا
سألت.
لما نيجي نعمل طب تعالي نحفظها مع بعض عشان نبقى في مراجعة يعني. احنا دلوقتي لو جينا
أيوه
نعمل اكزامينيشن بنعمل اكزامينيشن فيرتيكال وهوريزونتال. اول حاجه بمسك ايد
أيوه
العيان، والله بشوف فيها سويتنج ولا لا، وبشوف ايدي بايدي يعني بحط ايدي جنب ايده كده واشوف ايده كبيره ازاي. بعد كده
أيوه
باجي على الريست واقول له اف اي تاب هير ذير از بين، هيقول لك طبعا اه او لا على حسب. بعد كده
أيوه
هتيجي على ايده هتقولي ايه انا عايزه اشيك البلاد بريشر سيتنج وستاندنج والبلاد شوجر. اوكي. بعد كده
أيوه
البروكسيمال
أيوه
مايوسي عند الكتف. بعد كده
أيوه
عند النك هشوف السكين ايه السكين تاج والنيجريجنس. اوكي. والاكنسوس
أيوه
نيجريجنس. بعد كده هاجي على الاي اشوف جوندس وبالر واقوم عامله بقى الفيجوال اكيوتي والفيجوال فيلد واوفر الفندوسكوبي. اوكي.
أيوه
بعد كده هخليه يفتح بقه يطلع لسانه عشان اشوف الايه، عشان اشوف حاجتين: اللارج تانج وانتر دينتال سبيس. اللارج انتر دينتال سبيس الاسنان مفرقه عن بعضها. اوكي. بعدين
أيوه
هقف على جنب كده عشان اشوف البروجناديز وعشان اشوف I would like to check الايه الثايرويد. I want ايه كاب اوف ووتر. المهم يعني هيقول لك نيد ولا نيد الله اعلم. المهم ان احنا بنبص على الثايرويد يعني. بعد كده بنعمل تشيك على الايه على الشيست والهارت. الشيست بسرعه كده، الهارت بسرعه كده عشان اعرف ان كان في ميرمر ولا لا. والشيست اهم حاجه عندي البايفيزال كريبيتيشن
أيوه
اعتقد كمان والبلبة بيبيتون يعني. بعد كده بقول ان انا عايزه اوفر الابدومين فور اني ارجانو ميجاني. بعدين بنزل على الرجل بشوف الكريبيتس، الني
أيوه
عشان اشوف الكريبيتس، واللي هو الليمب عشان اشوف الايه اللارج فود، وفي نفس الوقت اشوف اللي هو الليمب 18.
أيوه
خلاص. ما انا خدته كده من ايده،
تمام
يعني من اول الايد وانا طالعه كل حته فيها حاجه.
أيوه
اوكي. بس
تمام تمام.
Okay, thank you, Dr. Shima, for the
ممكن
case. Finish?
تقريبا مش
Any
عارفه
other
ايه
comment?
كل حاجه.
Yes, I will not add too much comments. If you finish, Dr. Shima, are you done?
اعتقد ان كله تقريبا الحمد لله. سمعت بكره يا
Wow.
دكتوره وانا جميل ما شاء الله.
شكرا شكرا جزيلا دكتورة شيماء، شكرا جزيلا وإياكم، شكرا.
Dr. Mona, can you write the case for her, please,
Okay, thank
for the
you.
sake of the time? And I will add only comment for acromegaly. As you catch the case from first question, which is very important and very nice question about the loss of vision. When started the onset, the course duration, then you can ask what the nature of vision loss. Is it color? Is it night? Is it bumping into the object? Is it double vision, peripheral vision? And from this answer, you can get the case as you did. So you get the case from bumping into the object. It's positive for by temporal hemianopia. So it's some adenoma in the pituitary. Which type, according to the gland or according to hormone, either Cushing or prolactinoma or acromegaly. So you can ask about the hand size or the ring size, the shoe size. This is for acromegaly. Any enlargement of the breast or discharge coming from the breast, this is for the prolactinoma. And the last is Cushing. The question for Cushing, any stria or any bruising or any increase of the hair growth, this is for Cushing. Or non-functioning adenoma, it will be dizziness and panhypopituitarism. This is the the pituitary adenoma types. Okay, then you got the acromegaly. The question for acromegaly is for the symptoms and association. Symptoms, you know, you will ask about diabetes, hypertension, skin tags, coarse features, facial features, sweating, and constipation, as you said. But don't forget, as you did, the main one, starting from hyperparathyroidism, hypercalcemia signs and symptoms, feeling thirsty or passing a lot of urine, and the pituitary as diabetes or insulin or any other association from the pituitary, from the pancreatic cancer. Then the examination steps as you did exactly, but don't miss the family history. It's very important. I don't know if you ask the family history or not. Family history of any vision problem or family history of any gland problem, to be more specified in the question. Gland problem means either min 1 or min 2 or min 2A or 2B. So you can ask about gland problem. Okay. I will not add any other points because already covered the topic by you and Dr. Shaima. Yes, another point, sorry. The association of acromegaly, which are obstructive sleep apnea, it's very important. You have to ask about the driving, is very important. And driving and what else? Driving, obstructive sleep apnea, osteoarthritis. This is related to increase the weight. And the question for obstructive sleep apnea, of course, you know them. You sleeping well overnight when you're snoring? Are you feeling sleepy over the day? All this question, okay? I think the other finding in the case very clear and obvious for all. Yes.
بسيط بس افتكرته. هو احنا في اي فيجن بروبلم بنسأل 3 أسئلة. which you mean by vision loss exactly is decreased in the vision، او خصوصا لو كانت blurred vision يعني. او which part of the vision field which
Mhm.
eye is affected. which
Yes.
part ده مهم جدا عشان يحدد لي فين which eye is affected. ممكن تكون واحدة بس مش اتنين. ساعتها يعني فاهم which part is affected, which part of
Yes.
the field is affected, which eye.
Yes, exactly. And previous attack, some patient will have like multiple sclerosis on and off symptoms. And the very important question, the previous attack, it might guide you to another diagnosis. From the start, you can ask this question. Any previous attack or this is the first attack ever? Very important question. Okay, it will show something is chronic or relapsing, remitting, like multiple sclerosis or myasthenia gravis, particular time. I guess all knows these questions. So I don't want to talk lengthy more than this. Let's go to the next scenario. Dr. Shaima, are you ready? Your scenario, Miss Carla,
This is
34. Okay, take your time. Miss Carla, 34 years, complain of loose motion. Take history and examine. Yes, Dr. Ahmed, add also carpal tunnel is very important. So obstructive sleep apnea, carpal tunnel syndrome, and osteoarthritis, hypercalcemia as association, diabetes, hypertension. Okay, the vision and driving. Please, whenever you have complaint of vision problem, before going to the station, write the driving in bold letter or make it in circle or whatever, but just signify it, because once you go in, you will be in stress, you might forget it, and it will be against you. Any vision complaint, write the driving in the paper.
I have only one comment not related to this question, but I noticed
Yes.
and
Yeah,
everything
go ahead,
in the
Doctor. Sorry.
beginning you are saying, I just want to tell you that everything is confidential. This is wrong information. Don't say this because nothing. You can read the confidentiality. You so need to say this word at all. It won't give anything. He might give you less mark if you give him wrong information by telling him everything is confidential. So no need to say this word because
Yeah, I agree. I'm not saying it, but it's okay.
it has been
For me,
saying today. So
yes,
no need.
I know. Some doctors are saying it, but let me add a comment to you. You finished, Dr. Sarah?
Yes, I finished.
Yeah, I want to add every single second you must utilize it. So don't waste time to say, I will examine you. Yes, go ahead. Enter the station and start the history, confirm your name, the patient name, introduce yourself, and start from the complaint. Don't say anything else. You might need this seconds at the end to do some examination or to ask for something. You'll be in trouble. So no need to just say, yes, everything will be confidential. You are the one with the patient and the doctor. So why you are mentioning it? For me, I'm not never saying it. I will go and start history taking and examination.
Yes,
Yeah.
because this
Thank you,
also
Dr.
is not information, nothing confidential. We can reach the confidentiality in certain situation. If you are saying everything is confidential, and also this is not this is an examination or history, so they didn't talk about the confidentiality. So the confidentiality has its own scenario.
Yes.
So no need.
I guess yes. I guess the confidentiality in communication case, not in the long case.
Yes,
In
exactly.
HIV and sexually transmitted disease
And we will
and
reach.
TB.
We can reach it in some situations. So not, it's not right that we're saying everything is confidential because sometimes everything is not.
Yeah, I got your point.
Yes.
Thank you, Dr. Sarah.
Okay, I can start.
Yeah, ready to start?
Okay, I can start.
Yes.
Yes.
Okay. Timer started. Let's go.
Good morning. I am Dr. Rizabel, the doctor in the medical OPD today. Nice to meet you. Are you Mrs. Clara, 34 years old?
I am, doctor.
Miss Clara, today we are here to discuss issue related to your health, and I will examine you. Is it okay with you?
Okay, doctor.
Miss Clara, it came to my knowledge that you are complaining of loose motion. Can you please tell me more about that?
Yeah, doctor, it's around 2 months ago. It started that I have loose motion, and till now it's present.
I'm sorry for your suffering. Since 2 months, there is any previous attacks of loose motion before these 2 months?
This is the only one that take this all time, doctor. The other attacks, like usual
You
attacks
have
and finished.
other attacks of close motion also.
Yeah.
Since how long these attacks start?
The last one since 2 months.
No, I talk about all attacks. How long these attacks come and go?
I'm not sure, doctor. It's intermittent. It's not present all the
Okay,
time. It
okay.
comes
This
and
attack
goes.
similar to previous. This attack similar to previous attack, but it is long time. Yes.
Yeah, yeah.
Okay. Can you please tell me it is how many times per day?
It's around 4 to 5 times.
Okay. Since it started, it is increased or the same or decreased since two
It's the
months.
same, doctor.
Same. Four to is
Yes.
times per day. Okay. What is the nature of this loose motion? I mean, it is watery. It is loose motion or bloody, contain
Yeah, it
blood.
is watery, doctor. It is watery.
Water. Watery. It is watery. Since it started, it is watery. Yes.
Yes,
All the times it is watery.
yes.
Okay. Okay, Mrs. It is not contain blood or mucus.
No,
No blood or mucus. Okay. Okay, Mrs. Did you notice anything that increase it? Like certain types of food?
I'm not aware of that, doctor.
You are not here? What?
I'm not aware. There is nothing.
Okay. Do you notice anything that decrease it?
No,
Is it related to food? Is it related to anything?
I am not sure.
Okay. If there is any tummy pain,
Sometimes.
sometimes tummy pain. Okay.
Yeah.
It is all the time present, or it's sometimes loose motion and sometimes a hard motion. Since 2 months.
It's loose motion off.
Okay. It is associated by tummy pain, yes? Is this tummy pain? Can you prescribe
Not
to
all
me
the time, doctor. Tummy pain is coming on and off.
with this motion or not? Is it associated with motion or alone?
Sometimes I have, sometimes I don't have.
Okay. Any tummy distension?
No,
Any heartburn?
no,
Any yellowish discoloration of your eye?
no,
Anyone to use that you become big than before?
no.
Okay. This is 4 to 6 times per day. It is large amount or small amount?
It is not that large. يعني I can't decide on the amount, but it is not large amount.
Okay. How is your compensation? You compensate well for this loose motion
Yeah,
by oral
doctor, I'm
intake?
drinking. Yeah, I'm drinking more water.
Okay. What about your weight? Is there any change in your weight?
Yes, doctor, I lost about 3 kilo uh, within the last 3 months.
3 kilo. It is intentional,
No, doctor.
not intentional. Okay. Mrs. Clara, do you have any past medical illness or surgical operation should be aware of?
No, doctor.
Any surgical operation?
No, doctor.
Okay. Any joint pain?
No.
Any skin rash?
No, doctor, but sometimes my face turned to red color.
Red color, especially exposure of the cold?
I
If the
feel
sun?
that I feel that I'm flushed and my face is red.
Okay. Without any exposure to sun or something like that.
No.
Okay, okay. When these attacks you have flush and red, Do you have any heart racing in this time?
No,
No heart racing?
no.
Okay. Can you please explain to me or describe to me this is attacks of hardening of flushing and the hotness of your face?
What to
How many
explain?
times? How many times per day? Since how long it started?
It comes in on and off also.
On and off also. Yes.
Yeah.
Okay. Is it due to anything increase it or decrease it?
No, I didn't notice.
Okay. Do you have any wheezy chest? Any noisy chest? I'm sorry.
Yeah, doctor. It's about 5 months ago. I have problem with my chest, and the doctor prescribed for me the blue inhaler.
Below inhale. You
Yeah.
diagnosed as asthma?
I don't know what was my diagnosis at that time, but I'm using that blue inhaler.
You did the blowing test?
Sorry?
There is test called blowing test. Did you do it? Or you not don't know?
I didn't do any test.
Okay. Mrs. Clara. Okay. Mrs. Clara, do you have any high body temperature?
No,
Any lumps or bumps in your body?
no.
Okay. Do you have any tiredness?
Sometimes.
Is this tiredness all the time or a specific time of the day?
No specific time, doctor. Just I feel fatigued.
Okay. Is this fatigue, is there is anything increase this fatigue or decrease it?
I didn't notice.
Okay. Mrs. Clara, do you have any throwing up,
No,
any feeling sick?
no.
Okay. I will ask you some questions. It may be appear not related, but it may give me an idea. Okay. You have any headache?
Okay. No,
Any weakness?
no,
Any loss of sensation?
no,
Any loss of control of water work or back passage?
no,
You said to me you didn't have any heart racing. Do you have any chest pain?
no,
Any difficulty of breathing?
no,
Okay. Do you have any lower limb swelling?
no.
Do you have any cough of blood? You have some cough, yes.
I have some coffee, doctor. Yes.
This cough with phlegm or dry?
It's a dry.
Dry. Okay. Mrs. Clara, do you have any noise? You have noisy chest and you have dry cough, yes?
Yes.
Since 5 months now. Okay.
Yeah.
Do you have any water work change in the water work? Color, amount,
No,
frequency, any flow
no,
theory? Okay. Do you have any weather preference?
no.
Okay. Do you have do you have any family history of similar condition?
I'm not aware of any family history, doctor.
Okay. Do you have do you take any medication, Mrs. Clara, rather than the blue inhaler?
No, doctor.
Okay. Mrs. Clara, can I ask you some private question?
Okay.
What about your period? Is it regular?
Yeah, regular.
Okay. Do you have any history of miscarriage? Are you
No.
married? I'm sorry. Are you married?
Yes.
Any chance to be pregnant?
No.
Do you take any oral contraceptive pills?
No.
Okay. Do you have any history of miscarriage? You said no. Okay. Do you have any extramarital relationship? I'm sorry to ask you this question.
No.
Okay. Do you have any history of blood transfusion?
No,
tattooing,
no,
piercing,
no,
any travel history.
no, doctor.
Okay. What do you do for living, Mrs. Clara?
I am a businesswoman, doctor.
Businesswoman. How will this affect your job and daily activity?
Too much, doctor. I am always going for the bathroom, and this is troubling me too much.
Okay, I'm sorry for that. I will try to help you, and I can refer you to occupational health doctor, and I will try to help you as much as we can. Do you smoke?
No,
Do you drink alcohol?
socially.
Okay. Mrs. Clara, do you have any business when standing from sitting position?
No,
Do you have any tanning of your skin?
no.
Okay. Mrs. Clara, can I examine you?
Yes, doctor.
Okay, general look. Is it overweight, underbuilt? Check it.
No, she looks normal. There is
Okay,
nothing in her
الهاند
appearance.
البلس blood pressure vital sign
Uh,
كلها
vital signs normal all.
all normal. Okay, I will see the eye, any color, any jaundice.
No
The
color, no
mouth,
gender.
if there is any ulcer
No,
in mouth. I will
no.
examine the heart and chest. If there is any murmur,
There is wheezy chest.
there is wheezy chest.
Yes.
Okay, okay. Abdomen, if there is any renal berwee, any organomegaly,
There is hepatomegaly.
hepatomegaly. Okay,
2 minutes left.
uh, okay. If there is any lower limb edema,
No,
any crepitus in the knee.
no,
Okay, okay. Mrs. Clara, do you have any itching?
no.
Okay. What's your concern, Mrs. Clara?
What do I have, doctor?
Actually, Mrs. Clara, from you said to me and after I examined you, you most likely have a condition called the carcinoid tumor. This is attacks of flushing and attacks of wheezy chest and also attacks of loose motion. Can be caused by a specific overgrowth of growth maybe in different parts of your body and producing substances causing these symptoms. What we need to do now is to admit you and to do some investigations in the form of blood test and imaging, and we will sit with you to explain the proper management plan and the result of investigation. What we need for the time being, we need from you nothing. Yeah. Okay. Do you have any other concern, Mrs. Clara?
No, doctor, thank you.
Okay, any further question, Dr. Shaima, before going to examiner questions?
No,
You have
no,
still
no.
15 seconds. Okay, let's start examiner question. You can start, Dr.
Okay. Can you summarize your case, please?
This is a 34 years old female complaining with loose motion, which is which is watery in nature, and she also lost weight about 33 kilogram, and also she has wheezy chest and flushing of the face. In examination, she has wheezy chest and hepatomegaly. She denied any relation between this loose motion and anything, any food or anything. Uh, my very differential diagnosis may be carcinoid syndrome.
Yeah. What are
It
other
may,
differential that you can cause?
it
Watery
may be
diarrhea.
It may be infection, simple infection, but it has this
Like what
frequent attack.
infection?
Infection like what?
Mm-hmm.
Like
What infections that can cause watery diarrhea?
watery diarrhea. Infection can cause watery diarrhea. Actually, I don't know.
It could be Clostridium difficile, could be rotavirus, could be norovirus, could be Giardia.
Giardia, but Giardia usually do malabsorptive diarrhea. Could be Giardia, could be Clostridium difficile, yes.
Could be watery diarrhea also can be happen with Giardia.
Okay.
Like also, okay, how would you investigate this patient?
First of all, I will do a basic investigation and stool analysis and stool culture system. Stool culture and
Sorry,
sensitivity.
the voice is interrupted. Please, can you repeat?
Yes, 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 yes. I will do basic investigation and stool analysis, culture and stool culture and sensitivity. I will do also searching for carcinoid syndrome as I suspect carcinoid syndrome.
What is the specific test you will do?
Carcinoid syndrome, I will do for me five hydroxyindole acetic acid.
Yeah, right.
Indole acetic acid. I will do
You
five
don't need to do imaging.
Yes, I will do imaging searching for this carcinoid. I will do abdominal sonar and CB and also chest X-ray and the CT and abdominal CT abdominal pelvis. I will searching about this if I will searching about this carcinoid.
Yeah. How would you treat carcinoid?
Main treatment is surgical, but I can use also medical treatment of stereotype.
Actually,
Confirm.
most of cases can respond with octreotide. Yeah.
Okay.
The main treatment is octreotide and then surgical resection. Yeah, and
Okay. I will do a non-pharmacological and pharmacological, non-pharmacological in the form of patient counseling and education to patient about the disease, psychological support and nutritional support. I will also do pharmacological in the form of octreotide, and if not response, it can do surgical removal of this person.
and chemotherapy if refractory and can be is not operable, maybe chemotherapy. Okay, Dr. Shaima, you did very well. Thank you so much. I have no comment.
Yeah, thank you, Doctor. Thank you, Dr. منى for the case.
هو الهيباتوميجالي ده هو بيبقى معاه هيباتوميجالي؟
Metastasis,
Yes.
metastasis, it could be present in hepatomegaly. Carcinoid mainly affect maybe the gut and maybe sometimes liver, and also can present within the chest. Metastasis within the liver.
Yes, yes. Thank you for the case. بصراحة nice case.
You're welcome. You did
Thank
very
you.
well.
Yeah. Any comment, Dr. Mona?
No, thank you. Actually, she covered all.
Yeah, thank you. I will add only for the surgical option. It will be if no spreading. It will be as an early stage, fitting
Yeah.
for surgery, so they can operate it. Apart from
Yeah.
this, if metastasized, they can use, as you said, chemotherapy based on the octreotide medication. So it will be
Long-acting
like
octreotide. Yeah, it's most of
yes,
cases respond. Yeah.
response, yes, sensitive to the octreotide as chemotherapy. Apart from this, I guess the case here is clear. Triad of wheezes, diarrhea, and flushing comes and goes, and the clue here is recurrent attack. The good thing, Dr. Shaima ruled out the alarming signs with blood in the stool and relation to the food. This is a significant question. And also another question, very important here. You can specify the type of food, like pasta, pizza, if you want to rule out celiac. The other question she missed, flushable or no. So, but she asked by another way, does it contain mucus? But better to ask, does it flush or no? Or is it flushable or no? Just to rule out steatorrhea or malabsorption syndrome or malabsorption diarrhea. Apart from this, yes, the system review was okay, but you talk long, Dr. Shaima, for the history, and you examine the patient in 1 minute. Try to minimize the question relevant to this question, to this patient. If you want to ask for HIV, yes, you can ask quickly at the risk, but I guess also the
You
travel
can
is very
ask
important.
while you are doing examination also. You can save time and ask while examining.
Yes, I'm focused on that because I want to roll that. Yes, roll out that. Yes, this is your point, right, Dr. Muna?
Yeah, well, if she is still having questions in the history, she can
Mhm.
start examination while she is
Yes,
asking the patient. So,
yes, yeah,
yeah,
you're right.
while
Yes,
she is giving him questions, yeah.
exactly. So you will take both marks for the
بس
examination.
لا بس في حاجة يا دكتورة منى معلش، هو تقريبا النقطة دي ممكن تتاخد عليكي، لأن انت ازاي هتركزي في الفايندنج وانت بتتكلمي، فاهمة؟ يعني دي تقريبا دكتور صلاح كان قالها مرة أو حاجة زي كده، يعني الواحد لما
If
بيبقى
you have important question and you don't have time, you
انت لازم تعملي كده، بس
can
انت
do.
No, no, it's okay, Dr. Shema. You can do. You can stand up
You
beside the
can.
patient, do the step of examination, then you take rest or not rest. I mean, you will take a breath while asking another question. For if you have family history of importance, then you will say, I would like to examine, for example, the chest, the abdomen, or whatsoever.
Yeah, I mean to save time. If you are
Yes,
examining abdomen and you know finding and you forget to ask an important question, you can ask.
exactly.
Not all questions, of course, you can do. I mean, if you while examining and you just realize that you missed an important question, you can do while examining.
Yes, exactly. Yes. Okay. Any question from other colleague before moving to the communication? I guess the carcinoid syndrome is clear, as mentioned by the triad of diarrhea and flushing and wheezy chest. Comes in attacks and on and off. And yes, in the investigation, you can add like you are screening for cancer. It's like type of cancer, either benign or malignant. So you can do CT cap to stage the cancer. Is it in the chest, abdomen, any spreading or no? In this patient has metastasis in the liver, so I guess it will be like advanced stage. Anyway, let's go to the communication. If anyone has comment, he can post it. HIV travel diarrhea, yes, but I guess all this will be longer duration. As a chronic, yes, as a differential, you mean, yes, okay. So HIV travel diarrhea, but traveler will be an acute onset, not chronic. So in this patient differential, you can put irritable bowel syndrome because it's on and off. Irritable bowel syndrome, and you can say HIV if the patient has some risky factor or risky habit.
بي ار بي اوما.
Vipoma?
Huh?
Yeah, it could be, but she excludes this
Very
when
rare.
she asked about the amount, and I told it's not large or copious amount. Yeah, but it's
Yeah,
one of the differential of the water diarrhea. Yeah, you're right.
yes, watery diarrhea, but try to give the most common. I guess Vipoma is not so, but still, it's one of the differential.
دكتورة منى معلش، هو سؤال، هو الديفرنشال دايجنوز بتاع الوتر دايرية كارسينويد والانفكشن زي السي دي بي سي والجيرديز، وات ايلس؟
Rotavirus, enterovirus.
Drug induced also, I think,
ايوه.
can be drug laxative.
I'm not sure if it's watery or not, but it may contain food particles.
Yeah,
But
so if water is
abusing, I'm speaking about watery diarrhea. Could be carcinoid, could be viboma, as doctor said. Could
yes,
be
infectious like Clostridium difficile, Vibrio cholera, watery diarrhea,
Yes, you're right.
rice watery diarrhea, yeah. Could be enterovirus, all the viruses, rotavirus, enterovirus, and I think also Gardia. Gardia is one of the
But Gardia, I
protozoal that
guess, yeah, it will be
can
bloody.
cause
Will be
no
bloody.
bloody. The Entamoeba histolytica is the bloody one, I think, but Gardia
Okay.
it's causing massive watery diarrhea with severe distension at the blooding. This is
Yeah.
the Gardia. Yeah.
So let's say viral gastroenteritis or gastroenteritis with some virus to be more
Yeah,
general. I don't
but
want to
here
give.
the case actually don't have many wide differential diagnosis because this is classical triad of the
Yes,
syndrome.
exactly. Yes.
Yeah.
Yeah. So if you want to mention, try to mention the common. Better to say viral or gastroenteritis for viral infection, and the irritable bowel syndrome and carcinoid syndrome, as in this patient. This is for me. I don't know if for others they can put other differential, but I guess the
Yeah,
common is
it's
common.
right. It don't have a wide differential because it's
Yes.
clear.
Yes.
Nothing else do the triad.
Yes. Okay. Dr. Thank you, Dr. Mona, again, and Dr. Shayma for nice cases. Let's move
Thank you
to.
all.
Thank you. Let's move to the communication. Dr. Sarah and Dr. Aisha.
Yes, I am ready.
Yes.
Dr. Sarah.
Yes. I want me to send a scenario for you.
Okay.
So I'll send it now. Okay.
Okay, Miss Indira Malik, 35 years old female, wants to do BRCA gene testing. Has 3 aunts and one niece diagnosed with breast cancer. Her first aunt had it when she was 39 years old. Discuss with regarding the test and address her concern. Unique scenario, Dr. Sarah.
This is the counseling in genetic. So
Yeah.
scenario is repeating, and
Are
I have
you?
here in one course, and
Oh my God. It comes there in UK, I
I'm not.
guess.
I had it in the past paces course, and also
Oh,
there is a lot of counseling scenario about genetic Huntington chorea, polycystic kidney.
yes. Okay.
This is one of the
Those are accepted, but Barsha gene, I never heard about. Anyway,
okay.
let's see, Dr. Aisha, what she'll do.
Okay, give me 2 minutes.
I
Okay.
will give you 10 minutes.
No,
No difference will
don't
be.
worry. We'll
No difference.
discuss it. We'll discuss it.
Yeah,
Okay.
I know. Just joke.
Okay.
Okay, 2 minutes, then we'll start.
Okay.
Let me know, Dr. Aisha, when you're ready.
Okay, we can start.
Okay, let's start.
Okay.
Here you go.
Okay, hello. I am Dr. Mutwalli, the doctor in clinic today. May I confirm you are Mrs. Indira,
Yes.
35 years.
Yes, I'm Indira, doctor. How are you?
Okay, welcome, Mrs. Indira. We are here today to discuss about your health condition. To see to be in same page, how do you know, and what brings you to the clinic today?
Well, I'm coming today, doctor, for counseling from your side because I have a long history in my family. I have 3 aunts that they have breast cancer, and also my niece has breast cancer also. So I read in the internet that there is a gene called BRCA gene, so it can be done for screening for cancer. And also, my aunt has this cancer when she was 39 years old. So I'm concerned about that, and I'm concerned to have this cancer. So I come to ask about this test, and if I can do it, and what is the pro and cons of this test.
I really appreciate your knowledge, Ms. Indira, and I'm sorry for what happened to your relatives, and I hope they are doing fine right now.
It's difficult, but they are coping.
Okay. Okay. For first thing I'll tell you about that if any of your aunt have this gene discovered in their test, this is only a very small population that have this gene from ones have the breast cancer. There is small ones that have this gene mutation in their testing. Do you know this information?
I know one of my aunts has the BRCA gene. Their aunt didn't screen for that, and I think it helped her in the treatment. So, and I read on the internet that the BRCA gene, if it has been this present, it can pass to the other generation in the family, and there is a screening for it. So that's what
Yes.
I want. Yeah.
Okay, Miss Indira, I really appreciate your information, your knowledge. Let me discuss you more about this gene mutation. It is called gene mutation. That means that is the problem in some inheritance of this of one of our genes in your body, and this causing this gene to be liable, the body liable to develop some type of cancer. Mostly it is breast, and also some type of subtypes of ovary also cancer. For this gene, yes, there is a test for it, and they found it's run in families, so inherited. And for if it is positive, there is advantage, and there is also disadvantage. So we need to discuss with you this, so you can decide it with clear information and to know what you will do after that.
Okay. Yes.
So for diagnosis of and for doing this test, they will take them just snip from your mouse, from the side of your mouse, and it can take about weeks to the result to be maybe 1 week or 2 to the result be out.
Yes.
For the advantages of this test, that if you have this test positive, you we can expect that you have a chance of having cancer more than the other people, and we can teach you more about how to monitor yourself and arrange some scans for you. And if it is negative, it will reassure you that you didn't have this gene.
Yeah.
But I'm sorry to tell you, if it is also negative, it is not meaning that you will not have breast cancer in your life. Also, the bad effect that will affect it if you test this gene, that really not all the patient or the ones have this positive gene will have cancer in their lives. So it is less, it is more than the other population chance, but not all positive ones will have cancer in life. So you may be worried more. And
Yes.
really, for cancer breast, we have screening other than to doing that. And it may be more effective to know that you have the gene. Because if you have the gene, you will run the same measures for you to screen. If you have relative with breast cancer and you are susceptible to that, you will put it in a screen of your breast, and we will follow this according to the first screen. Like we will tell you that you will screen every 6 months or 1 year or 2 years, according to the first the scan. This is called mammography, and it is like just a simple test that we scan your breast tissue under X-ray, and it is the result will be available after the scan directly, so it will be no worries and no waiting. For this scan, we can follow this scan regularly, and it can give us information early if you have developed any changes and develop any cancer. Are you follow me, Mrs.
Yes.
Indira?
Yes, doctor. Yes.
So it is approved screening for breast cancer to do this scan for anyone susceptible more. And also we can teach you how you can examine your breast regularly and know if any changes happened. So we can pick this also early. And the same thing is we will do if we know that you have the positive gene. So it is no difference for management if you know this is positive or negative. But from your side, if you know this, you have this positive gene, may affect your mood strongly, and also it can affect your insurance, I think, if they know about this problem in when you apply for it. And as we said, it is not 100% if you have this gene, you will have a cancer in your life. So if we like weighted the benefit and risk, I not recommend that you will do this gene if you don't have this like first degree with the same problem or have this gene in your life. But really, till now, we should take in counseling from genetic counseling clinics. They can tell you more and explore your condition more and advise accordingly.
2
Is this
minutes
sound
left.
clear,
Okay.
Mrs. Indira? You have
Yeah.
any other concern, any question?
I have other concern regarding I'm planning to have a baby. So if I have this gene positive, it will affect my babies, and how I'll prevent this from happening to my kids.
There is a chance here. I'm sorry to tell you that if you are positive, there is a chance to pass this gene. But really, there is other thing that the gene, this is called gene mutation, and it is means that is the gene different in its shape by time, and it's not appearing from first days or 50 years. And maybe we will check one for this gene and found it's normal, and after that it will change in life. So also if you become negative test, it is not meaning that you will not have this mutation or this problem in your gene in the future. This sound clear, Miss Indira?
So you mean I'm asking about if I want to prevent this, if it's positive and I want to prevent this from happening to my kids, to inherit this gene, any possibility as preconception counseling or any precaution to be done not to transmit this faulty gene to my kids?
To be honest, Miss Indira, I don't know exact information about this question, but I'll include the gyno doctor in this information and the genetic counseling clinic, and soon we will arrange another meeting with you and inform you about possibilities and what we can do to help you in this regard and in this concern.
Okay. Okay. Thank you, doctor.
Okay, time's up.
Okay. You did it well, Dr. Hisha. I wasn't.
Well, أنا قعدت أجيب بصي قريت أي كلمة باليمين والشمال.
You did it well as a genetic. So this patient
Okay.
coming about asking about the BRCA gene. So you told her right information that the BRCA gene is a positive in it can cause cancer in the ovary and cancer in the breast. This, and you told her you have a strong family history positive. So the positive family history increasing the risk for breast cancer more than also the gene. She want to do the test. She can have the test. So you can. I'm not agreeing with you or not telling her I don't want you to do this test. No, you will give her all the possibility and tell her at the end. I will give you time to think about it. Think about the pro and cons.
Yes, you are right. Yes, I think when I tell this, I feel that it's not appropriate. Yes.
Yes. So you will tell her in any station for that, and you're not you don't give her this because she's coming for that and she can do it. So, and we are not quite sure it's right or not of this.
Yes, so we will give the benefit and
And you need to weigh about the benefit.
disadvantage, and she will decide. Okay.
This is the thing. The BRCA gene is if it's positive, there is a risk about maybe 60% that if she will develop cancer, breast cancer, and 60% to develop breast cancer, and 40% to develop ovarian cancer. So if she will have the BRCA gene and it's positive, so it means that she has the gene. So we can give her more precaution by doing that. You said that you can do for her regular MRI and regular mammogram, okay, to check really for the cancer. And also sometimes they are giving. I read this. They are giving chemoprophylaxis as tamoxifen. They sometimes give this medication to prevent, but it's not. We can say we can give you some. I will discuss it and we'll see. Maybe there is some medication there is for that. And you will tell her some people they will do if they have the BRCA gene positive, they will do bilateral mastectomy, prophylactic bilateral mastectomy, and salpingioophorectomy to have this cancer, and they can do it. This is prophylaxis. So the gene it can be done, and a gene if it's positive, and they're happy to do this operation. So you will tell her. This is if the test is positive, you might have you are at high risk to have the cancer, and also you have another risk factor, which is a positive family history. So it's a strong association that you might have it. And also if you have this test, some people have a positive family history of cancer and they didn't develop cancer. So tell her these things and tell her, and there are different way of management after having this test positive, including that we will follow you up. And there is some people are doing surgical. I know that this it looks scary things, but some people are willing to do that in order not to have this cancer. And it's a big operation. So you need to consider all these things if you will do the test. And you did it right by telling her if you will do the test and it's positive, you will be more in anxiety. And the test take from 4 to 6 weeks. And it could be, I think, saliva and it could be blood. I'm not quite. I read it on both. Could be both. That's right that you said it could be the saliva. So you will tell her about the pro and cons regarding the insurance. I'm not quite sure about the insurance because some insurance company they are not putting. This is a predictive test. So they are not put it as a risk, or they are not asking to disclose. It's written that the insurance company cannot ask to disclose the result of a predictive genetic test for majority of the policy, but change in the future. So you can your insurance, but this is a predictive gene, so they might not ask you to disclose it. But also you need to be updated with your policy, the insurance policy, and to see and ask them in order to be on the safe side. And you will refer her to genetic counseling about that. And other things you should ask her, tell her there are also some life modifications that help you to prevent have this cancer. But the good thing that you did it and it was perfect. We can teach you how to do examination on your breast. This is very important. So we can ask one of the specialist nurse. She will teach you how to examine your both breast. So you will do this on regular basis. And some lifestyle you might change. If you are smoking, there is a lot of some risk factor. We can have a further discussion with you to discuss it with you to modify your lifestyle in order to prevent the cancer from developing. She ask you about the pregnancy, so you will tell her if you have it's positive, you might pass it maybe 50% to your kid generation. I'm not quite sure of what we can do for you, but there is a lot of things now we can do. Preconception, she can take ovum from other people to have it, and they have so they can do testing from the amniotic fluid, or they can do selection of the egg. They can select the egg which doesn't contain the faulty gene. If she asks you, I'm not quite sure the scenario will take all this information or no, but this is all the things that can be asked in this scenario, or even other scenario for genetic testing. There's a lot of, they will ask about the pregnancy and they can pass this gene. So there is a good new development, so they can select the faulty gene and select the eggs which doesn't contain the faulty gene and reimplant it. So if she's asked you about this, and she might ask you about my sister also, I didn't do the test. Should I ask her to do the test?
خلصنا الزيت.
So you will tell her for this if your sister want to do it, we can give her the information and she can take the decision if she want to do it or not. Okay, and to know the pro and cons as you. This is the scenario.
Okay.
Yes.
Thank you, Dr. Sarah.
Thank
you, Dr. Shima. Dr. Aisha, sorry. But for me, Dr. Aisha, it wasn't communication. You were talking and you didn't even ask her following. You kept talking for maybe 3 or 4 minutes, explaining the cons and pros of the screening. And I think this is the disadvantage of knowing the information or the knowledge about this test. Better if you don't know, because you didn't ask her any question. You didn't ask her any understanding, any following.
No,
If
I
you
asked her a
kept
lot.
ask, no, it wasn't. Ask Dr. Sarah. I hear Dr. Sarah only at 8 minutes or
Yes.
at the end. Tell her,
No,
Dr.
you can
Sarah,
ask it, but
No, I asked
No, no,
about
I mean,
3 times. How you follow me?
try to, so the communication is two-way. Try not to talk for 3
Okay. Yes, okay.
up in between, and
yeah.
okay,
At least
this
if
is
you
the only
will
issue.
give, okay, you can ask her. Yeah, this is what I note, Dr. Aisha. Sorry. Try to accept, because the communication is like conversation way. Either to ask her
Yes,
if she
yes,
can
you are right. Yes.
understand what.
Maybe
Yeah,
I
but
didn't just focus on
you
this
didn't
because
notice because
Yes.
because you want to deliver the information as soon as possible, and you kept saying it, but you didn't follow her. This is my advice. You can say there is some cons and pros for this test. If you want to know more, let me explain. If there is another alternative test, better to do by yourself, testing yourself, and so on. If you don't know, but if you know, try to minimize the idea. She will not digest all these. She's not a medical field one. She can't understand what all you explained. Yeah, we can understand as doctors, but in the exam, she will tell you, doctor, what are you saying? I didn't understand anything. So either to repeat all this talk or to waste the time, and you can't ask her other concerns, and you might also lose the case. So the best way is to ask, and you can ask in between. You have any concern? Better to have a concern from her. If she asks you about her sister, yes, I will refer you to the genetic counseling team, and they will do 1, 2, 3. We can have the over selection, as Dr. Sarah said, if you want to have a safe baby. That's it. But I guess this scenario is Yeah, I didn't come before. I didn't hear about it, and it's very difficult to do screening. And the percentage of having cancer breast or cancer ovary, how long and how much over the families, over the generation. I don't
Yes.
think it's common thing. Anyway,
Mm.
Dr. Sarah gave us a good idea about this test. Maybe it will come.
The past basis course here is
Mhm.
famous course here in the UK, and
Mm.
more is are coming. So if there are
Yeah, yes, it's okay.
scenario, it might come. That's
Yes,
why to
this
this.
is this is what I said yesterday, Dr. Sarah. Sometimes rare scenarios we are practicing here in the sessions.
Mm.
Once you practice once, you will never forget it.
Yes,
So yeah, Dr. Aisha will never forget this information as well as you.
yes, but this is the idea of any counseling station.
Yes, yes. Yeah, you're right. Okay,
Mhm.
Dr. Aisha,
Okay.
please can you write the scenario for Dr. Sarah?
Okay.
She will write a difficult scenario for me. I know.
I
Revenge.
didn't prepare. If I'll prepare, I'll
Give
I
her
didn't
the
prepare hard
revenge.
one.
Your opportunity to take that revenge. But Dr. Sarah professional now in UK, so she can address any scenario.
I'm not too professional.
MashaAllah. Okay, this is my scenario.
The chat box. Okay.
Yeah. A picture.
Okay.
Okay, the big.
This is Ryder, right?
No,
Roch.
it is from the side of MRC.
Okay, the patient present to her family doctor complaining of tiredness with abdominal bloating and intermittent diarrhea. Diagnosis of celiac disease has been made. Her test results showed hemoglobin 97, serum albumin 32, and abnormally low concentration of folic acid and iron. Her calcium and liver function tests were normal. Celiac serology was strongly positive. Upper gastrointestinal endoscopy appeared normal, but small bowel biopsies showed subtotal villus atrophy, consistent with the diagnosis of celiac disease. The patient missed her periods ceased 3 years ago. Her family doctor has explained this result to her and the need to adopt a gluten-free diet since she started taking iron and folic acid replacement therapy. Her anemia has corrected and she is now feeling very well. Although she still has low stool, she is reluctant to go on a special diet because she thinks it may be unpalatable and unhealthy. Your task: summarize the nature of gluten enteropathy, celiac disease, to the patient, and explain why it's important for her to go on a gluten-free diet. We'll give you 2 minutes, Dr. Sarah, then we can start.
Okay.
Don't forget the patient name and the age. Yeah, she
Okay.
writes here, Miss Annie Beth, 42 years, librarian, and who has been found to have celiac disease.
Okay.
Ready, Dr. Sarah?
Okay, ready.
Yeah, I will remind you 2 minutes before the end.
Okay.
Yeah, let's go.
Hello, my name is Dr. Mahmoud. I'm one of the doctor here in the clinic. Am I talking to Mrs. Ann Bass? Hello.
Yes, doctor, I am. So,
Can I confirm your age?
I am 43.
Okay. So, how I can help you today?
Well, doctor, my family doctor sent me here, so you can explain to me more.
Yes.
He trying to tell me the result of this procedures that I did recently, and he tell me just as a surprised diagnosis, and I am concerning about this diagnosis, that how you will change all my life, and I just becoming good, and I have no any problem right now.
Okay. I appreciate your concern, and I'm here to discuss with you about your condition and to explain for you more about that. But did anyone explain? I can see from your notes that you have been diagnosed with the celiac disease. Did anyone explain to you what is this condition and how you will manage it?
Really, doctor, I don't know what
Okay.
is this celiac disease caused by. He tell me that I should stop gluten, and he tell me what I should do, but I don't know why I catch this disease.
Yes. Okay. I appreciate that. So, and when you went to the GP to do this test at first, what symptoms did you have?
I just feeling tired, and some spells of loose motion. It is intermittent, and she didn't bother me a lot. And I used to be feel bloated all the time, distended, but it's also not a big problem for me.
Yes.
I also have like stopped the menstruation past 3 years.
Yes.
But also it is no matter for me, doctor.
Yes, I appreciate that, and I can see what you are worried about, but I just want to ask you, so let me explain for you about this condition. So the celiac disease, it means that your body interact faulty to some proteins that you are taking, not some wheat or some, the ingredient in the pasta and the bread. So when you are eating these foods, the body interact faultly with it and try to destruct your gut. That's why you have this diarrhea, and because your gut is not digesting food well, so you will feel this tiredness, and you might be the cause that your menses has been stopped. So it's this disease is usually an autoimmune disease it's mean by that the body is attacking itself. So we need to control this disease by asking you to have a gluten-free diet. How does that sound, Mrs.?
Really, doctor, I am now feeling well. My doctor giving me iron and folic acid, and I keeping taking it. And anything, I think I don't need anything other than this, because my condition really become good after this supplement.
And what about the diarrhea? Are you still having this diarrhea?
It's just not very bad, doctor.
Yes, okay, but yes, that's right. The doctor gave you because you have this diarrhea, your body is not absorbing the nutrient and the salt, including the calcium and iron. That's why he gives you this supplement. But if you continue to have this diarrhea, most of the nutrient won't be absorbed, and you will become more weak. And you become more tired, and this will affect your bone, you affect your health. So
I can take supplement, doctor, from time to time.
but the diarrhea is not controlled. Anytime you will eat the food, and this food you will be intolerant to it, so it won't be digested. So you won't get benefit from this food, and you'll have this diarrhea. And this will affect your health, and you will become more weaker. So the main treatment in this condition is the gluten-free diet. And can I ask you why you don't want to follow a gluten-free diet?
I think, doctor, I hear about this in the past. It is like expensive and difficult to find.
No, this is not true. We have a lot now because this condition is started to become common. So they started to do a lot of of um, of um, of food in the market that it contain gluten free. So you will have a lot of variety of food, and I can refer you to we have a specialized dietitian nurse, so she can help you and sit with you and explain for you all the nutrient and the diets you can follow, and she will give you a variety of foods that can help you with that. How does that sound?
Well, doctor, but really I like the food. I'm making my own food. I like to that is the food to be tasty good. And I think with this restriction, I'm not able to do that because it will be very expensive. I making research on internet about prices of this food. If I need to do the same that I used to making cakes like this, I found it is really expensive.
I really appreciate that, and I can see how it is very difficult to change your lifestyle and to feel yourself that you have some restriction with food. But the issue is here that we need to be aware about that. If this condition is not controlled by the gluten-free diet, it might deteriorate, and you will feel more weak and more tired. But and also the other things, as I told you, there is a lot of variety of foods that you can do delicious food, and we will ask the dietitian team to follow with you that.
So will I have this follow this diet, doctor, for my rest of life?
I'm sorry, yes, to tell you that it will be your lifestyle in the future, in order to have this disease controlled, have this gluten-free diet. Because there is no treatment for this condition. It's only by diet restriction and to follow a strict diet.
Okay, doctor. So my family doctor tell me that I need some scan for my bone.
Yes, this is it. Yes. Okay. So for the scan, because as I told you, this disease can cause that the calcium, which is important for bone, is not absorbed. So that's why we need to do the scan to check if your bone is strong or lack of calcium. So we can start for you other medication for that. Because if your bone is weak and you have a condition called osteoporosis, it means that your bone is weak. So you might have some fracture and have bone pain. So we don't want you to suffer with this condition. So we need to do this scan for you to check for your bone condition.
2 minutes left.
Yes, doctor. I really worry about that because my mother, like in his 70s, become stopped and it is have some bone pain and the problem in his bone. So anything to prevent this to happen to me.
Yes. So when we'll do the scan, we will give you some medication that help your bone to be more stronger, so you won't suffer from these side effects. Okay. So I can arrange for you the scan, and also I will book for you with the dietitian team, so they will talk with you, talk through the gluten-free diet, and give you a plan for how you'll have your diet, and we'll give you a follow-up to check for your condition and to check for you lose motion, if it's controlled or not, and to check for also, we'll give you the supplement, and already the GP gave you the supplement. So we'll check on a regular basis if your body is deficient in this substance or not. How does that sound?
Okay, doctor. Well,
do you have any other questions?
So if I follow this diet, doctor, I'll be free of all of these symptoms?
This disease is mostly controlled by the gluten-free diet, and most people we won't have all these symptoms, and we can live their normal life.
And my loose motion will also resolve it?
Yes, if you are not exposing your gut to this type of food that the body react to it, so you won't have this loose motion.
Well, doctor, thank you.
Okay, can I ask you a question? Do you smoke?
Yes,
Okay, so how many cigarettes per day?
like 5 cigarettes per day.
So also smoking can affect your health and also can affect this condition. So I can refer you to the smoking cessation clinic, so they can give you some medication to decrease your craving for smoking. How does that sound?
Okay, doctor, I'll think.
Thank you. Okay.
Okay, thank you.
Okay, time is up.
Okay.
Almost.
Okay, well done, Dr. Sarah.
Yes. Okay. Say, give me
Yeah,
comment.
sorry for conflicting to you a lot.
No.
For this scenario, we're talking about celiac disease.
Mm.
So first, how you will introduce celiac disease to the patient.
Mm.
Just, it is not autoimmune disease. If I'm wrong, you can correct me.
Yes.
You
Yes.
can't, we can't call the celiac it's autoimmune because it is not attacking the body. Just he attacks the gluten, and if the gluten is present in the villi, he will attack.
Yes.
If not present, he will not attack.
Yes. Yes.
Okay, so it's not autoimmune. It is just, it is small, it is characterized by small intestinal injury or gut injury, and the nutrient malabsorption in genetically susceptible patient or individual following dietary ingestion of gluten. The pathogenesis, it is like interaction between environment, genetic, and immunological factors. So just you can simply define to the patient there is you are susceptible for this disease, and since it is not known the cause that your body reacting aggressively with the gluten when you eat. It may be environmental, it may be some problem in eating, or some problem in your genetics, or it is like interaction between both, because we don't know the really cause of this disease till now. Okay.
Yes, but it's for this condition, it's written celiac disease is a condition where the immune system attacks the own tissues when you eat gluten. So I think it's mean autoimmune.
Yes, it is autoimmune.
Yes, there is background of
Autoimmune?
autoimmune. Yeah, autoimmune, and you can say multifactorial also. Yeah,
Yes.
it
It
can
is
run in family.
multifactorial, not autoimmune. It's
Autoimmune,
like
autoimmune
No,
disease.
it's autoimmune. That's why you are screening for other autoimmune, Dr. Aisha.
Yes, it is autoimmune. انت حتى لو فتحتي يا عائشة على اي سايت بيشرحها دلوقتي انت واحنا مع بعض هتلاقيها كلهم بيقولوا serious autoimmune disease. It is autoimmune disease.
Yes, that's why I think like this.
okay,
It is
no
genetically
problem.
predisposed.
I need someone to correct me. No problem.
Yes.
Okay.
So we can see it multifactorial and including the body attacking.
Okay, we can see that the body immune system overacted to gluten in food, and this reaction damage your tiny or hairy-like projection that is called the villi in line of your gut or small gut. This villi absorb the vitamins and the mineral and other nutrients from your food. If it is damaged, you can't get enough nutrient, no matter how much you eat. Okay.
Okay. Yes.
Okay, so you should, if the patient is reluctant more, you should concern about other complication of celiac. Not only the malabsorption is the complication of celiac. You can talk more because you can convince the patient more why she will be restricted in all her life and will be like in this situation. Okay, so not the malabsorption only, because she kept said to you, I'll take supplement.
Yes.
So you will also advise about the other complication of celiac. You will see the bone weakness and the infertility and the miscarriage and the lactose intolerance also, and the cancer. There is 2 cancer with the lymphoma and the small bowel cancer increase risk with celiac disease. Okay. And there is also some nervous system condition with celiac disease, like seizures in some cases. So you will warn him about communication to be more convinced that she will stay her life, all her life after that, because she fear also about complication. So about expensive diet.
Yes.
There is support from the NH available for those who have celiac disease, as there is prescribing food on the prescription she can take. So
Yes, but okay, yes.
I search about this
It's not here. It is
to
not
make
here يا
sure.
عادي. يعني هو مش موجود هنا في الدول العربية.
لا
No,
حتى هنا في
present
السعودية
every
بيعملوا كده.
market. No, there is in the big
لا
markets.
يعني أنا قصدي الهيلب
لا هيلب بتديها
الجفرمنت
ببلاش
بتعمل
prescribe.
هيلب سبورت
Okay.
للسيلياك
I'm not
سبورت
sure,
للسيلياك
but
أصلا.
suppose the
احنا هنا
dietitian will support in any
احنا
hospital.
هنا بنعمل كده.
اه
هنا
طبعا
هنا في
Any
السعودية.
هنا
yes,
طبعا هنا
sure.
بيصرفوها كله
Yes, for
مجاني.
dietitian, it's
يصرفوا لهم
dietitian
يعني كميات
ايوه
concern.
كبيرة.
في فرق بين ان هم يعملوا سبورت، يعرفوني الاكل ايه، ان هم يدوهم
لا
فلوس او
بيصرفوه
حاجة،
بريسكريبشن.
او يصرفوا لهم
لا
فلوس، او
بيصرفوا لك
يصرفوا لهم
الأكل
اكل.
نفسه أولا، بيصرفوا الأكل نفسه أولا على بريسكريبشن. يعني أنت بتاخد أصلا جلوتين فري دايت من المستشفى.
أنا ما أعرفش
مم.
الموضوع. I don't
ما
know.
اعرفش المعلومة دي، اول مرة اعرفها.
هي هنا
Any
نعرفها
any
طبعا، لكن أنا
any
عملت سيرش على اليوكي. أصلا عاملين أصلا سايت اسمه سيلياك
society, yes, society.
سوسايتي.
There is society.
Okay, yes, yes.
Is exactly.
Yes. The NHS can support you by give you gluten-free diet.
فهي لو عندها الايشو بتاع الاكسبنسيف و I can't found this as you said this one of issues, as you said, it is now available and you have plenty of alternatives.
Yes.
And there is only small restrictions.
Mm.
But also you can mention that I'll as you said with the patient support also there is society of the celiac disease, and you will find the people like you, and they can also like explore the experience and share the experience with them.
Yes, you are right with this.
And you can mention if she said to you it is really expensive. I search of internet, it's expensive food. There is support from this society and they give you prescription for a gluten-free diet.
Okay, that's good. Yes, you are right. Okay.
Okay, I think which other concerns in the last for life? Yes, I'm sorry to tell you that. Prevent osteoporosis. Yes, you can give. We will follow you and give you medication. We will arrange a scan to follow how much your bone affected by this condition.
Okay, and regarding the dermatitis herpes form, we can talk with her about this or no need?
I think
If she raise it
if the
only.
scenario, yes.
Yeah,
Okay.
if she raise it and
About diarrhea, it is well not promised طبعا in the medicine. Most
yes,
probably it will improved because the diarrhea in celiac can be not improved also after restriction for some time because there is something of intolerance in the first months. They can stop lactose also, and there is bacterial overgrowth in some patients, and there is
and resistant as well.
Yes, and the refractory it is rare, but also there is a lot of possibility that the diarrhea not resolved in celiac, and they can search of other causes like bacterial overgrowth, pancreatic insufficiency, and about also
Lymphoma. Lymphoma, I guess, also a
maybe
complication.
also lymphoma.
So
But lactose intolerance most very, very common with the celiac.
So I will tell her usually resolve if it's the cause is celiac, but if there is other cause, as you have sensitivity to other food.
You will not mention, but in your mind, you will not promise.
You will not
Yes,
mention
most
أصلا
probably
هي تتعارض مع
Already
الهدف
told
خالص.
her, mostly we
you
will. I didn't
you
say
will resolve. Yes, we will
much,
be better, and we
but
will keep up you. If you have any queries or any problem, we can discuss.
okay. Okay.
But I think we will not talk about what is the causes because we already convinced the patient to stop gluten, as Dr. Shema said.
Okay. Thank you so much, Dr. Aisha.
Yeah, thank you, Dr. Aisha, for the scenario. But I want to add some comments for Dr. Sarah because this is the first time.
Yes.
Well done, of course, as the first time.
Yes.
But try not to take any history. You ask her twice about her symptoms, how many lose motion.
No,
All
but
this.
yes, I asked her about the diarrhea in order to tell her because she's saying I'm feeling well, so I'm trying to tell her no, you still have the diarrhea.
Yeah,
So,
but not as a question, Dr. Sarah. You can enumerate the symptoms and you will tell her isn't, or this is what happened with you, like that. But don't tell her, can you tell me what symptoms you have? Of course, this is, she will tell you the symptoms and this consider as taking history. What you can do, you can just say here the disease is autoimmune and means that the defense system attacking your part in your gut leads to the symptom which you have. Right? She'll tell you, yes, doctor, I have the symptoms of 1, 2, 3, 4, for example. But don't give her direct question. It's a clear sentence in the instruction. Don't take history.
Yes.
So don't put yourself in this position
She can
that you are
also
taking.
said, I see from the letter of your GP that
Yes.
still you have like loose motion, like that.
Yes,
Good.
exactly. But don't say, yeah, tell me what symptoms you have. Otherwise, you did great. As the first time you addressed the concern, you kept asking about understanding, and the last 2 minutes you ask for the concern. Yeah, good start, Dr. Sarah.
Thank you.
Carry on.
But usually in the communication, when I'm doing the communication, at the beginning, I ask the patient how much do you know about the condition in order to be on the same page.
Yes.
Because
This, yeah, but
to put it, to take it as defense, because you have this, so we did this. So no
yeah,
need
but
to.
don't specify the question as tell me
Ah.
about your symptoms. This is history, but tell me what you know about your condition. Yeah, doctor, I have 1, 2, 3 diagnosed before. And you started good when you ask her, you want me to explain about the disease? She said, yes, doctor. So supposed to start to explain, not to ask her what symptoms you have, because you know the disease and you know the symptoms. So instead of asking her, you can enumerate for her the symptoms, and she will tell you, yes, doctor, you're right. I have all these symptoms and I'm suffering. And you can say, yeah, I'm sorry for your suffering. What you went through, we will try to help you or whatsoever. Okay, this is the way how to get the information from here without asking direct question.
Okay, that's good.
I hope it's clear. Yeah. With the practice, you will avoid all this type of question. Don't worry. We did all these mistakes, initially when we start practice. But as first time, really, you did great.
We're still doing, no problem.
And my exam.
Yes, Dr.
November.
Aisha talked for 3 or 4 minutes without asking. The
and
most important is in the exam.
I read some information. I'll forget it. I need to finish.
Yeah,
I
and
will
you'll be lucky.
Because my exam is in 3 weeks. So I'm not quite sure I'll be qualified.
No,
No.
don't
Good
take
luck,
it in the
inshallah,
negative.
and
Yeah, don't be.
you are clever, mashallah.
Yeah, don't take it with the negative comment or the feedback. Do it as take it as positive, and you'll be much better in the next time. Believe
مثلا
me.
انت بيسز ولا يوكي ايريش
بيسز UK.
بيسز يعني فين السنتر بتاعك؟
سان توماس جايان سان توماس هوسبيتال في لندن.
ربنا
Good luck, Dr. Sarah. Don't worry at all. You can do it. Yeah, we believe in you. You will be perfect, inshallah, in the exam.
Hopefully. Thank you.
Okay, we will give you priority if you want for practice, if your exam is very near.
Okay, thank you. That's really helpful.
Most welcome. Yeah. So if you want any practice, just send me. You can do the long or communication, whatever you want. Okay.
Okay, I will do with you next time. Okay, thank you.
Yeah.
Okay, thank you.
Okay. Any other question? Thank you, Dr. Sarah. Thank you, Dr. Aisha. Any other questions from others? Any comment? Yes, Dr. Hadil or Dr. Ahoud. Thank you, Dr. Ahoud. She shared the celiac disease, and from the first sentence, Dr. Aisha, celiac disease and autoimmune condition. Sensitivity. You can say, yes, it's some disease which attacking your gut, but again, it's as a defense system misdirection. So it's autoimmune. Okay, Dr.
Asthma is
Aisha?
autoimmune. Asthma is autoimmune.
Asthma, there is types of asthma, and there is type of asthma is like autoimmune, IgE, or the other one is eosinophilic.
Autoimmune disease, asthma.
It's allergy or hypersensitivity, overreaction. Yeah, overreaction
Yes,
to pollen.
the celiac is the same.
But there is
celiac is the same.
so it's
It is
written in this.
multifactorial. It is not autoimmune.
Okay,
Okay,
but
it
don't
was
deny
maybe
it's
some.
not autoimmune.
سيرش
It's
سيرش
not
about دكتورة عائشة، هي مكتوبة كده
Yes,
فعلا.
I know.
Dr.
Just
Dr. Aisha,
I ask
Dr.
you
Aisha,
because I am
whenever,
not make sure about my thinking
okay,
because I
okay,
think about this a lot.
let
Yeah. Okay.
me ask another question, Dr. Aisha. When you screen for diabetes and other autoimmune, what the disease you are screening for? And you are saying I am screening for autoimmune, vitiligo, celiac,
It is
diabetes,
pure
thyroid.
autoimmune, yes, because you can't prevent and just
You
your
said
control.
autoimmune, right? You said autoimmune
Yeah.
now.
No,
Okay, thank
I
you.
think about the other, not the
The
celiac.
others autoimmune. Still
عارفة يا عائشة، أنا بحس ساعات إن أنتي ما شاء الله بتشغلي عقلك زيادة عن اللزوم.
hard
يعني
headed.
كتير قوي،
Hard
أنتي
headed.
بحس إن أنتي عالمة، يعني عالمة ما شاء الله. يعني هم قالوا أنتوا خشيها
ايفن
وخلاص.
دكتور باسل ويسكرين مثلا تيشو ترانسبلانتومينيز انتي بودي انتي جليادين انتي بودي انتي كده انتي
Yeah, there
انتي
is antibodies against the body, so
انتي بودي
means yes.
يس
Dr. Aisha, all against you. خلاص. Give
Okay.
up, Dr. Aisha, give up.
Just I'm thinking with you. It is not information from
Again.
like just
Okay, give
because
us
I'm
an
thinking
evidence.
not
Give us
autoimmune really.
okay, give
Yes.
us an evidence and share it to the group for the sake of the time.
another name جليادين sensitive enteropathy right this may go with Dr. Aisha opinion جليادين sensitive enteropathy
Don't try.
another name right
I think she'll give up خلاص because we are give up, Dr. Aisha.
Yes, yes.
Okay. Yes, no.
I need to pass this exam. Nothing other
Okay,
than
all
this.
of us. This is our aim.
Anyone
No
has
worries.
also recently? You'll have it? Or you still didn't book?
Sorry?
You booked for the exam? You and the patient
Yes.
exam
Next month,
Yeah, Dr.
inshallah.
Yes.
next month. So we are all next month, right?
Yes.
Okay. Hopefully we'll do it well.
Best of luck, all of you. Inshallah, you will do it. Inshallah. Hopefully, don't worry.
Yeah.
I mean, inshallah. Any other question?
No, thank you.
Thank you all. Thank you.
Okay. Thank you, Dr. Aisha, Dr. Sarah, Dr. Shaima, and Dr. Mona. See you tomorrow, inshallah, with another day.
Okay, thank you so much.
Good luck and good. Thank you. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Bye.